Okay, awesome. So I think we can get started. So thank you everyone for joining the CADASIL Consortium for today's webinar titled Navigating the CADASIL Journey, Understanding Genetic Counseling, Testing, and the Next Steps. This webinar is done in partnership with the InformedDNA team and our speaker, Tricia C., who I will let introduce herself shortly. As an aside, please save all questions for the end of the presentation to be inputted into the Q&A box. And thank you again.
Great, thanks for the introduction. I'm really happy to be here with you all today. As was mentioned, my name is Tricia C. I'm a board-certified licensed genetic counselor at InformedDNA. I'm the director of our neurogenetic services there. And I'll move forward. Great, so the agenda for today, we'll cover what is genetic counseling, so that's kind of top of mind. First questions first, then how to prepare for a genetic counseling session. We'll talk a little bit more in depth about genetic testing considerations related to CADASIL, and then next steps after a genetic counseling appointment or after genetic testing. And as was mentioned, we'll leave time at the end for Q&A, so I will go through the chat and read the questions and respond to whatever I can. So InformedDNA, just a quick intro, was founded in 2007, nation's first telehealth genetic counseling company. And we are, many of us are board certified licensed genetic counselor who provide services via telehealth across the United States. So our interest here is we do provide some counseling for participants as part of the CADASIL consortium. So very happy to be here. So first things first, I get this question a lot, personally, professionally, and maybe top of mind for many of you. It's just this, when you hear genetic counseling, what is it? So to understand what genetic counseling is, it's helpful first to get a better sense of who genetic counselors are and who they aren't. So genetic counselors are master's levels trained healthcare professionals. We go to graduate school specifically for genetic counseling, so we're specifically trained in this field and have expertise and really deep level training in both medical genetics and counseling. We are not physicians, we don't go to medical school, and we're not nurses, although some may have nursing backgrounds. So we don't prescribe medication, but we have very specific and honed expertise in, again, medical genetics with a master's degree in genetic counseling. We're licensed, and many of us are board certified, or we're all board certified. Many of us are licensed in many different states. So some of us will go on further and have expertise in specific areas like neurogenetics, cancer genetics, cardiovascular, pediatrics, reproductive, ocular. So we are in all different specialties. So it's a little wordy, so I won't read the whole thing, but this is the technical definition of genetic counseling from our National Society of Genetic Counselors, which is the process of helping people understand and kind of better understand the medical, emotional, family implications of genetic contributions to disease. So what does that really mean? It means we help interpret family and medical histories to help assess the chance of disease either occurring or recurring, educate individuals about the management of that condition, testing options, management and prevention, and then counseling. Really, the goal of this counseling is to promote informed choices in decision making. So it's not psychotherapy. It's not, we're not, counselors in the similar way you might see a psychologist or psychiatrist, but we do have training to help kind of people adapt and cope and make decisions that they feel comfortable with. So when to seek genetic counseling? So really, it's really best practice, and many professional societies do recommend and strongly encourage genetic counseling before genetic testing is done. So any type of genetic testing, that could be, as we'll go into, diagnostic genetic testing or predictive genetic testing. So it's really kind of best practice to seek that even when before the testing is completed. And then certainly after genetic test results have been received, it's highly recommended to see a genetic counselor. So maybe you didn't see a genetic counselor before the testing, certainly always a good idea and can be helpful to see a genetic counselor after the results are back. But really, I like to point to this third category, which is really anytime. Genetic counseling is appropriate and certainly available anytime you or a loved one or family member has questions or concerns about a possibly inherited condition in the family. So it may not be that it's really been confirmed to be inherited, but maybe there's a thought that it could be. So this is, as an example, maybe someone has a family history of Alzheimer's disease that they're concerned about, and they really want to learn more about that. So that would be an appropriate indication for genetic counseling. And certainly in the context of CADASIL, anytime before testing is done, after the results are back, or if there's questions about a CADASIL diagnosis or possible diagnosis in the family. So really there's many different, there's no kind of wrong way to do it. Anytime you have questions that would involve genetics and a genetic counselor, counseling is indicated. So easy. So why is really genetic counseling important? It's important because genetic testing is really quite different from most medical tests. So it's not a cholesterol test. There are ripple effects that can be felt often throughout the entire family, because what we're looking for with genetic testing are changes in the DNA that can be or may be inherited or passed down through the generations. So there's a lot of important things to think about when genetic testing is done. So genetic counselors are really, because of that, a very important part of a care team. So this care team may involve neurologists or primary care providers, many other different medical specialists, and a genetic counselor is really a part of that care team. So it's an important resource, either in any part of the journey. Genetic counselors are also here to help support and guide decisions, provide emotional support, and help. Really a key part of this is helping understand the test results that come back from genetic testing. So genetic testing is complicated, as some of you may know. It's not as easy as, again, a cholesterol test that we use that as an example. Some of the lab reports that come back from genetic testing have many different things to consider. And I know we like to think of genetics as kind of black and white, but it's really not that way. So there are some complexities that a genetic counselor is really specifically trained to help interpret and communicate appropriately. And then also genetic counseling is important because a genetic counselor can help identify next steps. So where do we go from here? Maybe there's a diagnosis in the family or a test result that's come back. Where do we go? Where are the resources? It's really the genetic counselor and the genetic counseling appointment is there to help identify these screening recommendations, potential clinical trials, support resources, registries, kind of where can we go next? So the genetic counseling can help shepherd one through that journey. The other question that sometimes comes back is, well, how do I prepare for genetic counseling? What should I do? How should I get myself ready? The first step can be important to collect some medical history about your or loved one's history related to the concern for the appointment. This doesn't have to be the entire medical history. So it's really just, again, very specific to that question. So it may be the most recent neurologist consultation, or something, asking a loved one about the diagnosis. That can be as simple as that to help prepare. It's also a good time to talk with family members. So to talk with family, learn more about the medical history of first, second, and third degree relatives. So you may need to talk or get in contact with other family members. Again, with the caveat that we're not going to know everything about our families. We do the best we can, but it is helpful for the genetic counseling appointment to come prepared to answer some questions that might come up. This next part it can be very important as well, and that's to gather any test reports that have been done from the family. It's not always required, so some research studies may not require that to be obtained ahead of time. But in general, if I'm going to speak kind of broadly about genetic counseling, having or knowing about the genetic test results that have been performed in the family can be really helpful. The genetic counselor can review them again, make sure they were interpreted properly, and can really provide with proper, when those results are available for a counseling appointment, it can help the genetic counselor get a really accurate risk assessment for others in the family. So that's sometimes it can be a very critical piece. And then the third part, how to prepare, is write down your questions. So what questions do you have related to the reason for visit? What do you want to learn? What are you hoping to gain? Any questions about the condition in the family that you feel like have never properly been answered, bring them. I think the genetic counselor is a really great resource for some of those questions and will answer as best they can. So then the other question comes up a lot of times is what should I expect? What really happens during a genetic counseling visit? So we'll talk about both pre-test, so this is before genetic testing is done, and then I'll talk a little bit what happens during the post-test visit. So during a pre-test genetic counseling visit, I put these like bricks, not in any particular order. And I think that's really just to highlight that this is not a cookie cutter appointment. This is not a step 1, 2, 3 that has to go in a certain order. The goal of the genetic counseling visit really is to meet you where you are. So perhaps during some visits, there may be more education that occurs, and others, it may be more discussing psychological considerations or what the implications of testing may be for family members or children. So these are all kind of standard elements of a pre-test counseling, but the amount of time that are spent is really up to kind of what one would need. So it's between you and the genetic counselor to discuss and really determine. First thing that usually does happen, though, generally is contracting, and contracting is really just figuring out, hey, what can we do for you? So what questions do you have? How can we help? What have you learned so far? And the goal of that, as with many medical and healthcare visits, is to try to kind of meet you where you are and answer any questions. So they'll usually do some contracting in the beginning to figure out kind of where we should guide the session. Then, always there's a little bit of education about, perhaps the condition in the family. So in this case, maybe CADASIL. And again, that's tailored to what you would need. So if you have, an extensive knowledge of CADASIL, then maybe less education is needed. If this is your first time talking with someone about CADASIL, as for some people it might be, then maybe more education is helpful. What's helpful to know is genetic counselors have experience in hereditary disorders. So for some people, this can be very helpful if they've never really met with a provider that knows what the condition of the family is. Genetic counselor can be a great resource for learning more about that condition. Genetic counseling in the pretest setting involves risk assessment. So what is the chance that we might find a change in a gene? What other, who else might be at risk? So a really detailed and personalized risk assessment is available, as well as then the implications of genetic testing and the options for genetic testing. Is it a single gene test? Is it going to be multiple genes that we test? How much would that cost? How are we going to proceed? What are the logistics? And then even further from that, what types of results would come back and what would they mean? So it's really important in the pre-test genetic counseling visit to go through, what would it mean for me if I tested positive? What would it mean for my children and my family members? What would it mean if I tested negative? So all of that is really covered in depth in the pre-test counseling visit, as well as any psychological considerations. So emotionally, what would it mean for a person to have a positive or negative genetic test result? And then through this journey, usually at the end, there's a discussion of where to go next. So is genetic testing being elected or maybe deferred to a later time? So it's really not the goal of the genetic counselor at the end to get you someplace specific. It's really to figure out what's the best option for you. We also usually do bring up genetic discrimination and legal protections just to make sure that people are aware of what the protections are, and answer any questions that they might have about that. The genetic counselor, this is just an example of family history. We'll usually take a 3-generation, what we call pedigree or family history. For those people who might not be aware, the circles are females and the squares are males. They usually draw a family history to help visualize how a condition may or may not be passed down in the family and identify who else might be at risk. So this is an example, and usually they will give that back to an individual at the end of the counseling appointment as well to keep. So in a post-test genetic counseling, so let's say an individual did decide to pursue genetic testing, they'll be offered a post-test counseling session. I think it's important to note here as well with the CADASIL consortium that some consortiums and studies and registries don't require an individual to learn their genetic test results. So post-test genetic counseling is really considered optional if people would like to learn their results. So it's even if you've had genetic testing, maybe for the purposes of study inclusion, it's not, some studies and situations don't require that you learn those results. So post-test counseling would really be for persons who have elected to learn their results and did pursue testing. Importantly, what genetic counselors will often do is confirm that an individual is really ready to receive those results. So a quick check-in, making sure there's not some lingering questions that could be answered, and that you really are interested in learning the results of the testing. Then there's a communication of the result as clearly and concisely as possible. And then really diving into any result-specific considerations. So again, where to go from here, depending upon the results, and identifying, providing support resources. Oftentimes there'll be a written summary of the verbal communication, so a summary of what was discussed, as well as routinely individuals are given a copy of their own genetic test report if they elect to learn it and if they elect to move forward with post-test counseling. It's also in post-test counseling, really important conversations that happen as to who else to share with and how will that look. So, okay, now that we know the results, who else should I share this information with? How will I share it with them? And then we oftentimes in genetic counseling will give a family member letter that people can share with family members to help guide those conversations. And I would say post-test genetic counseling I added in this bullet is really an important part, regardless of the results. So it is important, even if the results are negative, meaning they may not find the DNA variation in the family, it's still an important conversation to have with a genetic counselor. Oops, sorry, I went forward one too many slides. Here we go. So then specific to CADASIL in counseling sessions, it's really important, especially with post-test, to go through, is the diagnosis confirmed? So for a person who maybe is seeking genetic testing because of symptoms they have that they or their provider think could be related to CADASIL, it's important that with their genetic test results, the genetic counselor could walk through, does this confirm the diagnosis? Could there be another explanation? Genetic testing, specifically with CADASIL, can also be informative if there may be a concern for a symptom that may or may not be related to CADASIL. And this is true of some of many hereditary conditions where there could be a symptom that's quite common in the general population, such as migraines, but may or may not be related to the condition that's in the family. And in the post-test counseling session, depending upon the results, the genetic counselor could walk through whether or not these may be related or not. And then we'll obviously always involve the local healthcare provider for additional guidance. Okay, now I'm going to dive a little bit more into specific genetic testing considerations with CADASIL. So important to distinguish two different types of genetic testing. One we call diagnostic genetic testing, and this is really referring to genetic testing of a person who is showing symptoms of that disease, really with the purposes of clarifying or confirming a diagnosis. So this scenario would be a person who maybe presents to a doctor with stroke-like episodes and the doctor is concerned or has questions about a possible CADASIL diagnosis, and genetic testing would then be diagnostic genetic testing to try to figure out, is that true? What does it mean? How can we better manage the condition? So that's called diagnostic genetic testing. We'll go into a little bit more of that. Predictive genetic testing is slightly different. That refers to genetic testing for a person for a familial mutation who does not really have symptoms or clear diagnosis. So this would be a person who maybe has a family history of CADASIL, has a known mutation in the family, and is seeking genetic testing as a way to better understand if they will develop symptoms of the condition. So these are a little bit different and have some different considerations that go along with them. The genetic test itself may be the same, but how we approach them and the considerations for the individual can be quite different. So I'll walk through a little bit now. I think it's helpful before I go into the predictive testing for diagnostic testing. So for a person who has symptoms of the condition and the provider is really recommending it for diagnosis, oftentimes the considerations, the balance may be weighted a little bit more in favor of testing for some persons, because again, there's medical symptoms that are prompting this that really would lead an individual down a different path if they have that confirmed diagnosis or not. It's still important to have the genetic counseling and still important to talk with a genetic counselor, again, because that diagnostic testing still could have implications for family members, adult children. So although it may seem like a straightforward test to pursue, and certainly could be reasonable, still important to have that conversation prior to the testing to say, well, okay, well, if I did test positive, how would I talk with people about it? What would I share? Do I feel supported in my journey? And what tools do I have to talk with other individuals in my family? So still important for diagnostic testing. Dive in a little bit more here with predictive testing. So, with predictive testing, there's many reasons why persons might or might not pursue genetic testing, predictive testing, CADASIL included. Reasons why some people do pursue predictive testing is the ability to plan for the future. And that planning could come in many flavors. So sometimes the planning is financial planning. Sometimes it might be career or life goals planning. So plan is not a one size fits all. It's just, could be any number of planning for the future. Some people also pursue predictive testing to inform reproductive decisions, so family planning. A big one that we also hear is and really it can be quite important, is a relief from uncertainty. So the knowledge of being at risk for a hereditary or potential hereditary condition, can be a huge weight on a person's shoulders. And so sometimes that kind of perceived burden, it really leads an individual to say, I really need to know yes or no, if I am going to have, develop this condition in the family. So finding either, getting either a positive or negative genetic test can provide some relief regardless of the result from an uncertain situation. Other times, people pursue predictive testing as a desire to clarify risk for children in the family, usually adult children. If that can be helpful for a person as well as more and more these days. I think we're in a great age of medicine where there's more and more registries and consortiums and clinical trials. So there is sometimes learning your genetic status, even if you don't have symptoms yet, can be very helpful to allow someone to participate in research. So sometimes knowing your genetic status is required just in order to get access to certain clinical trials. So it can be quite helpful. And it's, again, as important to note, sometimes this genetic testing is done, but maybe you don't need to learn the results. So it's always an important question to ask. Now, so why do some people decline to pursue predictive testing? Well, the big one is really concern about kind of the emotional toll it may take, regardless of the result. So these are difficult decisions to learn that one might be at risk for a condition, and certainly one to consider very carefully. It's not one to walk into without, thinking it through. So sometimes people will decline. It's not the right time for them. They're not emotionally prepared, and that's, the right decision for them. Sometimes there may be an underlying fear of receiving a result that's not in their favor, so one that they're not hoping to receive. Other times people do have concerns about genetic discrimination, about being treated differently based on genetic test results. We'll circle back to, around this topic at the end, so don't worry, I'll come back to that one. Sometimes people decline testing because there's lack of a cure. So they may think, well, if I'm going to live my life the same way no matter what, then maybe it's not a right test for me right now. So sometimes people will wait until there's more therapeutic options available. And sometimes people would prefer to live with hope. So, until you learn the result, there is still, a chance that a person might not inherit the genetic disease in the family. And so sometimes people really prefer to live that way. And there can be a concern over being viewed or treated differently by loved ones. And this is a tricky one, and we talk about this a lot in genetic counseling appointments. As far as some of these symptoms can be quite common in the general population. Forgetting keys, having migraines, all these things are very common and can be completely unrelated to a condition in the family. And so sometimes we just really want people to think about how they feel they may be viewed by others and have those open conversation with caregivers and loved ones to make sure they feel, if they find out the results, they'll feel supported in the way they want to feel supported. Logistically, genetic testing has gotten a lot simpler. So a lot of this has changed. Honestly, the field has shifted so much since COVID. Sample types used to really routinely be blood, and now it's more routinely saliva. And certainly for many studies, like with the CADASIL consortium, it's saliva is the sample type. So yes, blood is fine, but saliva is really preferred. And there's really no difference between the two as far as quality results. And I do get that question sometimes. So both are perfectly validated. So the sample type can be saliva. Test kits are often sent to an individual's home or could be at a study site. And it's usually a saliva testing. You really just follow the instructions on the kit. The most, I think, burdensome part of the process is you can't eat or drink anything 30 minutes ahead of time. So no coffee, no water, nothing. So, and you have to produce enough saliva. So that's just a little hiccup. I will say, I just because this question does come up as well, if you were to have water or something, food ahead of time and sent the test kit back in, there's really no risk of it being a wrong result. So it won't be that the result will show the wrong thing. It's mostly just it won't be able to be run. So when the lab gets the test kit, there may not be, the DNA may not be of the quality they need. So they just won't run the test and they'll send out another test kit. So no worry of it being a wrong result. Once the lab gets the sample and they isolate the DNA, the results could take 4 to 5 weeks. Sometimes it depends on the lab and the time of year and how busy they are, but around 4 to 5 weeks is pretty standard for genetic testing. And then once the results are back, they would schedule a post-test visit with a genetic counselor if a person wanted to learn those results. So again, if they had planned to learn the results of genetic testing, regardless of the result, the policy is normally to schedule a counseling appointment, either over the phone or in person if there's in-person counseling that's being done. So possible results that come back, and some of this, again, I'll walk through a little differences between diagnostic and predictive testing. So either way, diagnostic or predictive, the results could be positive. They could identify what we call a pathogenic or likely pathogenic. Those are the words the labs use. We call them disease-causing mutation in the Notch3 gene. You may hear it referred to as mutation or variant. They're kind of used interchangeably, kind of migrating more towards using variant, but you may still see it referenced as mutation. So the results could be positive, meaning that, again, they do find the disease-causing change in the gene. They could be a negative result, and that could either be a true negative or an uninformative negative. A true negative is really a negative test result, meaning the genetic testing did not identify a Notch3 variant in a person who had a known family history of a disease-causing variant. That means that someone else in the family has already tested positive. That way, why it's a true negative is that we know that there was a gene mutation that we could find in the family, and that person that we are testing now does not carry it. We know that. So that's called a true negative, meaning you're truly not at risk. An uninformative negative could be either a person who's healthy, does not have symptoms, maybe no one else in the family was available for testing, maybe the person with CADASIL has already passed away, but they tested negative in Notch3. And it could be that maybe we don't have the proof we need to really say for sure that was the correct diagnosis in the family. We don't have anybody else who's tested positive. So it's a little bit uninformative, meaning that we're not quite sure, the risk is not quite zero. Or this could be in a person who we think may have a condition, they test negative, and then we have to think more about what else that could mean. Is there another condition we should consider? Results from genetic testing, and Notch3 is no different, can be uncertain. So these are called variants of uncertain significance. They are basically variations in a gene that the lab doesn't have enough data about to say for sure it changes the function of the gene or if it's a normal variation. Kind of weirdly enough, our DNA is not spelled the same way across all of us. So all of our DNA is a little bit different. Not all those differences are bad. In fact, most of them are quite fine and don't cause any medical issues at all. So when the lab sees these differences, if they don't know much about them, they label them as uncertain and they watch and they wait. So they gather more data. And what happens is that much of the time they get reclassified as being normal or negative. Sometimes, however, though, they do get enough data saying that, yes, this is a pathogenic variant. So in these scenarios, we really do need to walk through that in great detail in the genetic counseling appointment to make sure that you really understand what it means and what it doesn't mean. It's a little bit of a gray zone there. I don't like those, but. So implications for genetic testing, I went through a little bit of this. So with positive results, so again, if a person has symptoms of the condition, this could be confirming the diagnosis. Positive results, obviously carry a lot of emotional weight, and we really want to take time when we're thinking about genetic testing to make sure an individual is really fully prepared to process and incorporate this information. So we always say in genetics, once these results are shared, you can't take them back. So what we're identifying with genetic testing is a change in the gene that has been there since birth. And all we're doing during the genetic testing is kind of opening that envelope or finding out what was there. So I always encourage people if there's any concerns about it being a difficult time in life, or not quite sure you want to find out, it's okay to wait. This result won't change, and it's okay to not find out the results or not pursue the testing. Implications of testing, obviously there's some family implications to think about. We like to think about these in the pre-test setting, to really go through and make sure that we have a good game plan for who the information might or might not be shared with, and how will that look. Sometimes people want to wait until after results are back, but then they're processing a lot of things at the same time, both the feeling of being at risk and also who to share this information with. So it's always important to kind of think a little bit more in advance about who one might want to tell and how that will go. And the genetic counselor can help with that. Negative test results. So obviously relief, right? When a person tests negative for a variant that's in a family. There's also, though, oftentimes unanticipated complex emotions, just because there may be other people in the family, maybe siblings, maybe extended relative, maybe adult children who test positive. So just because a person tests negative doesn't mean everyone else in the family will. And there can be some feelings of what we call survivor guilt, meaning the feelings of kind of being spared when others weren't. And those can be complex emotions and take a little bit of time to work through. We talked a little bit about uncertain results. Uncertain results can be a challenge. There really can be feelings of relief or disappointment or confusion. And genetic counselor is really here to support a person when they do get uncertain results. We all, I think, like to have things in kind of a yes or no category, and this kind of gray zone is a difficult place for our human brain to live. We don't want to deal with uncertainty. There also could be, relief or disappointment for a person who is seeking confirmation of a diagnosis. So they had the symptoms, they thought it might be CADASIL, they got an uncertain result. Okay, well then what does that mean? Where do I go from here? How do I clarify that? So there can be a lot of uncertainty and some disappointment that there wasn't a clear answer. Sometimes family member testing might be helpful. I wouldn't say it's guaranteed to always give us the answer, but when we have uncertain results, sometimes testing other people who might or might not have the same symptoms can give the lab more data, and that sometimes can clarify the results. Not always, but sometimes. So it could be a part of the journey. So I wanted to touch upon, I know a lot of people often have questions about genetic discrimination. So I want to level set. So as of, so there's a federal law called the Genetic Information and Non-Discrimination Act, and that was signed into law in 2008. So it's been around for quite some time. It really is designed to protect our any kind of discrimination based on genetics. So it's designed to help protect us against health insurance discrimination and employment status discrimination. So an employer can't ask for genetic testing, ask for results, or change employment status based on genetic test results, similar to health insurance companies. So even if you went through your health insurance to get genetic testing, they can't change the premium, they can't drop you from coverage, they can't change your coverage benefits. So this is a really nice federal protection that we have, so it applies to everybody in every state. There are some rare exceptions. They are quite rare. GINA does unfortunately not apply to members of the US military or veterans obtaining healthcare through the Veterans Administration. Always important to talk with the genetic counselor. There's some different protections there, but GINA by itself is not covered for those individuals. And also for if you already were diagnosed with a condition. So if you had already had a diagnosis of a genetic condition and then got genetic testing, obviously the health insurance company would already know about the diagnosis. So that kind of trumps any genetic information that comes back. There are also smaller companies, so under 15 employees also are not fully covered under GINA. There are some state-specific laws that will even provide additional coverage above GINA. So GINA is kind of our floor. This is the baseline protections for everybody in the United States where it applies. And then there's state-specific laws that go beyond that. So I always encourage people, if you're considering genetic testing in your state and have questions about discrimination, to either work with a genetic counselor or consult the local laws to see if maybe your state even goes above and beyond. For example, with GINA, the exceptions here are that life insurance and long-term care are not protected. So life insurance companies they may not, but they could in theory ask if genetic testing was done and what were the results, as well as long-term care insurances. I mentioned this is always important. Once you have them in place, they can't retroactively go back and ask about genetic test results so if you have life insurance and long-term care in place, then if you have genetic testing, you're all set. It's not going to go back and you don't have to disclose at that point. But I do mention there are some states that even have protections in this level. So Florida, I think, is the one that did it soonest. I'm not sure if they're the only one right now, but they actually do protect life insurance and long-term care from genetic discrimination. So some states go above and beyond, and I expect more to hopefully in the future. So. And always important. So this is always a very important part of our conversation, especially for people who don't have symptoms who are doing predictive testing, to say, if you want to find the results, before you find those results, let's have a discussion about what your plans were for life and long-term care. Is that important to you? Do you want to get those in place? We do have some people who will defer or think more prior to learning results because they want to make sure they have this in place for themselves. So family implications. Keep my eye on the clock here, make sure we have time for questions. But so who should you tell and when? So this can be a little different for diagnostic versus predictive. So for diagnostic testing, this may be an important result to share with a larger healthcare team for the purposes of managing the condition, as well as family members, so they are aware, hey, this is a condition that you may also be at risk for. You may also want to get symptoms checked and just be aware of them if they arise. So that can be really important to tell people. Predictive test results, people are, there's no right way to do this, and there's no specific formula, but it's really kind of what works best for you. And I always encourage people to think about kind of what would be most supportive. So when you're sharing these types of results, who will be a supportive person on your journey? And if they're not going to be, maybe they're not the person that you share right now, right? But these can include, adult children. There's, as parents, we always want to protect our children and oftentimes do what's best. Sometimes that is sharing difficult news, right? Sharing, our own genetic test results doesn't mean that those individuals have to get testing themselves. So it is an individual journey for everybody in the family. And, if you take 5 people in 5 different families, you'll get any different iteration. Half the people will test, no one will test, everyone will test. It's a very specific and personal journey here. But genetic counselors can really help walk people through that. Who should I tell? How should I tell them? What would it mean if I tell them? What would I want to know if a person, if this were in my family? That can be a helpful conversation to have. Kind of, would I have wanted to know? When would I wanted to know? It can help you think through different options. Minors, so people who are under the age of 18, it's really not recommended by most professional societies, such as the American College of Medical Genetics. They really don't recommend testing persons under the age of 18 years for adult onset conditions. So these can include adult onset cancer conditions, and as well as adult onset conditions like CADASIL. So that's really the guidance. It's not a law, so certainly there are nothing legal here, but it's usually recommendation that we follow. So where to go next? So how to find a genetic counselor. So there's the National Society of Genetic Counselor, nsgc.org is a great place to go to find either an in-person or a telehealth genetic counselor. And then, within the journey and the genetic counseling appointment, if a person does, have post-test counseling, there is really a opportunity to have a good discussion on clinical trials, registries, any opportunity for where to go next. Genetic counselors, because we work really specifically in hereditary disorders, have kind of our finger on the pulse of what's happening in each of these conditions. So we are good resources for getting connected, as well as with support organizations. So support organizations are a wonderful part and option for many people, and we can help identify ones for people who are at risk for different hereditary conditions. So this is all part and parcel of the genetic counseling experience. And if any part of this sounds appealing, it's certainly a great option for many people. All right, so I left about 15 minutes left for Q&A. I will pull up the chat, and I don't see anything in here yet, but I will.
Trisha, I think the questions are in the Q&A box.
Okay, maybe I'm in the chat. Yep, thank you. Let me see if I get this. Here we go, yes. Let me just expand it on my computer here. Okay, perfect. Okay, great question. So someone asked, this is a really good question, and I love this. Thank you for asking. If someone does not want to know their results, so changes their mind later, absolutely, totally fine. And really, I applaud people who think about this only because you really know yourself and your decisions may change. So until you are the exact moment where you're learning those results, on the phone, in person, from your provider, you really can change your mind. So those results are there, they stay there. It's a lab result that doesn't change and doesn't kind of disappear into thin air. So one could change their mind, even if people change them the day before the appointment. I don't want to know right now, that's fine, come back a year later. So very acceptable, and certainly encouraged for people to think about it, and no genetic counselor will ever be offended if you kind of cancel the appointment last minute. It's fine. So how does genetic testing affect life insurance? Is it a different process if testing is received through a research study? So it's a great question, and I always try to nail down, exactly what this means. I think, the problem is there's so many different life insurance companies. Some companies, it's quite possible and likely and probable that don't ask about genetic testing at all. So you could find a life insurance company that doesn't ask about it. You don't have to disclose it. No impact whatsoever. Some companies may ask if testing was done, or some companies may ask the results of that testing. So they're all kind of different scenarios. Research studies are different. Some research studies have special confidentiality agreements that they may have with the NIH, where they don't have to kind of put the results in a medical record. So they may not need to be disclosed. So I think it's a really good question. I think it kind of depends, and definitely a great question to ask a genetic counselor as well. So I guess I think my bottom line is it doesn't always affect life insurance, and it really depends on the specific scenario. So I don't want people to feel like it's always 100% going to be a barrier. And again, different states have different protections. So Florida actually, has complete protections there. Great, someone had a really nice comment. Thank you. I don't know if I'll read that out loud, or Iman, if you want to as well. But great. How do you talk about genetic counseling results with family members? That's a great question. And I like to approach it, I encourage people to think about yourself, so we're all human. We have all been through difficult things and have had, experiences that shape who we are. So sometimes the first place I start is, how would you want to know? Would you want to know? I think sometimes there's a feeling like, I don't want to tell people because I want to protect them from this burden. Whereas maybe for themselves, they would say, well, I would have wanted to know. So I do want people, I do encourage people to kind of think about how you would want to know, how you'd want to be told. Oftentimes it can be helpful to tell people, I say oftentimes because every situation is different, but can be helpful to tell people before the testing's done, or before the results are back, to give them an option that maybe they can share with you they don't want to know. So we do have people that will share, hey, I am going through genetic testing. This is the type of result that could come back. Would you want to learn my result? And you may have a sibling or a family member that says, thank you for asking. I don't. I'd like to remain, in the blind about this. And so that way you kind of feel like you're having their feedback and your feedback. You can feel heard, but also respect their decisions. And I do think the other plug I'll give is that our children and our adult children are so savvy and read into things and are so smart and can cope with really difficult things. So sometimes you may be surprised that they may already know things that we haven't shared, or be thinking something worse than is actually there. So sometimes that openness and that just starting the conversation can be super helpful. Does InformedDNA have a network with other insurers? Yes, we're in network with most major insurers. Certainly, Cigna, United. I certainly reach out to me. I'll put my email address in the chat, or Iman can share it as well. That you can reach out to me about cost. And certainly for CADASIL Consortium, you can reach out to Iman as well for that. But many research studies, there won't be a cost. Sorry, I'm scrolling through these. Give me a minute. Oh, so someone's sharing that they had to have a daughter tested. The anesthesia was required because there was a parent that tested, and that's unfortunate. Yeah, I strongly feel this is very optional, right? Because genetic testing is so personal, and sometimes there's a scenario where it's really strongly indicated. Maybe the genetic test will lead to, could put one at really high risk of complications or some kind of therapeutic issue. But even then, it is your genetic information, is your decision. So I really strongly encourage people. Unfortunately, it didn't look like it happened here, but to really advocate for yourself if that's testing that you want or that person wants. Because again, once you find out, you can't unlearn it, which is unfortunate. So great. So someone wants to know where they go for more information. So places like Cure CADASIL, the CADASIL Consortium, great places to find out more information. Clinicaltrials.gov is a great place to go for clinical trials. You can put in the gene, you can put in the condition, and it has a listing of all usually open, soon to be recruiting, and sometimes even just recently closed clinical trials. So I really like clinicaltrials.gov for that, just to keep your pulse on what's new, and people can go back, check back periodically for updates. Yes, and so share. So I will also put in a plug here that there are many other young onset genetic dementias that are offering research-funded genetic counseling and testing. So no charge, wonderful service. All include genetic counseling and the testing. That's so many of them. We have such a great time these days. It's a dominantly inherited Alzheimer's network, the all FTD, frontotemporal dementia. ALS has many research-funded testing programs. Huntington's disease. These all have a similar protocol to the CADASIL Consortium, and it's been working great. I think people really these days are hungry to learn more about their genetic status in a safe and low cost environment. I mean, cost is an issue, so I think this is all really wonderful. Oh wow, so many good questions, everybody. I'm going to get through as much as I can. Okay. Someone had a question about lipids and Alzheimer's, and I will say email me offline, only because since it's a CADASIL audience, I'll I'll defer that question to another time. So someone asks, is a child's under 18 but old enough to understand what's happening, so upper teenage years, with a parent that has had significant enough impact, is asking to be tested, are there additional resources to help educate and determine course? So many times, yes. And I would tap into the Huntington's disease. So HDSA has a lot of great resources on how to talk with adult children or young adult children about this. I know it's a different condition, but some of the considerations can be the same. And I think there's more and more. Oftentimes the support organizations, if you reach out, might have other individuals in the same situation. I wouldn't want to say there's a magical cutoff at 18 as well. It's really recommendations, but everybody's different, right? Maturity levels are different and the family is different. So under 18 is a guide. It's not the law. It's not hard and fast. It's really just that with younger individuals, what we want to make sure is as they grow into a young adult, they have the agency and the emotional maturity to feel confident that this is the right choice for them. So that's really what's behind the 18. our frontal lobe develops at different times, right? So my doctors have never heard of CADASIL. Have all genetic counselors heard of it? Well, all genetic counselors who work in neurogenetics, yes, definitely. So this is kind of the benefit of working and having genetic counseling, is that we are much more familiar with rare disease than common things. So we're not dealing all day with cholesterol tests. We deal in rare disorders, and people in neurogenetics are quite familiar with CADASIL. Okay, so as the main reason for child testing is to test prior to child planning. And secondly, what's the best age timing for family for genetic testing? So I think, and please chime back in, individual, if I'm not getting this question right. So I think you're saying wait to 18. Well, I wouldn't gather. I'd love you to clarify a little more, but the best age for family, best timing for family genetic testing is so dependent on the individual. I think sometimes people, if they're maybe in a relationship where family planning is something they want younger or earlier than others, they may want to get genetic tested earlier than others. It's so personal. The main reason for the under 18, again, is just emotional maturity and consent. It's that as people, if the symptoms won't develop under the age of 18, then really the goal is to defer that decision until a time when that individual is kind of fully prepared to think through it. That's the 18 rule, really. If I've received genetic testing through InformedDNA, will let me know if a clinical trial arises, or do I have to search for it? Great question. So, I think there's, with all genetic counseling, we want to look, at the time. So at the time of the appointment, what's available, that's certainly something we would do, or any genetic counselor would be able to do. As that changes, the goal is really to give you the tools to look for them. So, there are some research studies and situations where one may be alerted to any upcoming clinical trial. I'm thinking of like the Dominantly Inherited Alzheimer's Network and some others. But as far as an individual genetic counselor at InformedDNA or a local genetic counselor, they most likely would not reach out preemptively to every person with a condition, but caveats arise, so it's possible. But usually they would direct you to where you could find more through time. So genetic testing, so you clarified prior to childbirth. So this is prenatal testing. So a person asked the question about genetic testing prior to a person being born. This is a complicated topic, definitely worth discussing with genetic counselor. Like the under 18 rule, most genetic counselors and healthcare providers are hesitant to test an unborn child for an adult onset condition. Obviously, there's no law here, but it is, again, much younger than the age of 18. So usually this is something that people don't strongly recommend. They usually encourage people to think about it. But sometimes people, again, with family planning may make different family choices. Again, very personal. So definitely no right or wrong at all in any of this. If an individual is worried about passing it on, they may consider other reproductive options, which can be discussed with a genetic counselor. Once someone has had a stroke due to CADASIL, are there medical specialists or a research hospital that specializes in CADASIL specifically? Well, yes, there's many researchers who know quite a lot about CADASIL, and where you find them and how you find them may depend. I'll call out, I just know Michael Geschwin, if he's on the call or listens, as a UCSF and is quite a CADASIL expert. Anybody, you could probably reach out to anybody through the CADASIL consortium, and they could, hopefully try to identify someone in the region. Sometimes also the support organizations will be aware of where regional experts are, but there's not a specific search tool that I'm aware of that will pull up just CADASIL experts. So sometimes it takes a little bit of digging and contacting people through research studies, consortiums, and support organizations. Okay. Is IVF a good option for people with a genetic mutation for dementia? So good. I would not put the word good on anything, just again, because these are very personal decisions that people make on their own. In many In some states, there could be the ability to do what's called pre-implantation genetic diagnosis with IVF, where they would test an embryo. That is a full conversation with somebody about whether or not that's an option for a person. But it is certainly something that has been available historically. So pre-implantation genetic diagnosis, and that's again pre an embryo being implanted. What would you recommend to someone who tested positive and they want to have children? I would say see a genetic counselor. This is just a great thing to discuss with a genetic counselor. So many things to consider, so many things to think about and discuss, and absolutely, very good question. But and thank you. So wonderful. I hope this has been helpful for everybody. And certainly, you're welcome to reach out to me. I'll give my email address. So any questions after the fact, happy to help.
Awesome. Thank you so much, Tricia. That was a very informative presentation. And on behalf of the consortium, we would like to thank you for your time and for a very detailed presentation about the nuances of genetic testing. Since we are at the end of the presentation, if there are any additional questions, I included Tricia's email in the chat, and I'll include my email as well, just to emphasize. And feel free to forward any questions. And thank you again, everyone.